What do you think is the #1 symptom of cardiovascular disease? Most people would think some chest pain or shortness of breath, but the #1 symptom is death. And this comes in an era when heart attacks and strokes are completely preventable. I'm Dr. Firemilk, and I created the Optimal Heart Attack and Stroke Prevention Center to give patients the care that they want and deserve. I've evolved as a cardiologist to pioneer a new brand of cardiovascular disease prevention based on a proactive model. I don't want to wait until an incident occurs before I can apply the appropriate technologies and treatments to my patients. My Optimal Heart Attack and Stroke Prevention program would be individualized for you based on your genes and your propensity for future problems. We need to identify not only existing disease, but what are you at risk for in the future? In the usual standard of care model, I felt like I was working for the insurance company, not for my patients. I work for you, not the insurance company. One of the myths of cardiology is the concept of mild disease. It's never normal to have plaque in your arteries, and this needs to be addressed in a very proactive way. So what about treatment? Unlike other centers, if I find an abnormality, I just don't slap a drug on it and hope that it goes away. I need to search for the root causes as to why the disease is there. Once we find root causes, we can create a comprehensive and holistic plan to help with your overall health. Dr. Firemilk, isn't that cholesterol and blood pressure? Those are some root causes, but what about osteoporosis, migraine headaches, thyroid disease? Once we find root causes, we can create a comprehensive and holistic plan to help with your overall health. We use objective measurements over time so we can prove to you that we're healing the insides of your arteries.
We'll use this to look at where you are today versus where you are tomorrow.
We use cutting-edge technologies to evaluate every member patient, such as inflammatory biomarkers, genetic testing, and salivary testing.
It is not just a one-size-fits-all. We spend the time with each patient to find out what their basic lifestyle is, where it should be, where they want it to be, and we fill in the gaps specifically to meet their needs.
I use evidence-based supplements wherever possible, trying to avoid the toxicities of prescription medication. As Arizona's first and only concierge cardiologist, I can go above the usual standard of care to offer truly exquisite care. You have unprecedented access to me and to my staff, and you can truly feel that we're holding your heart